Hi, welcome to week 10 of NUR 1000. I hope everyone had a wonderful spring break. The first thing we're going to do is look at our week 8 homework assignments and address what you did there. So the first thing, you had a midterm check-in for your discussion board. There were a couple concerns that came up repeatedly. So the first thing that I noticed a lot of people mentioned, man, really nervous with my skills checkoff. And that's totally common. The best thing you can do is to go into those checkoffs feeling prepared. So really have the steps of the checkoff or the skill mastered. Utilize your open lab hours to really get comfortable with the skill. And then also you're learning how to be a little comfortable when you're uncomfortable. So in nursing, there's going to be times when you're uncomfortable. You're doing new skills at the clinical site. You're having an uncomfortable conversation with a patient. So you're learning how to get more comfortable when you're feeling uncomfortable, which is important. Reminder to make sure you have a good study schedule. The best way to go into class feeling prepared is knowing that you have dedicated the time you needed to be on top of the topics that are being presented. It also helps decrease anxiety. You're going in feeling prepared. It helps with test taking. And don't forget to schedule some time for self-care as well. Also, I saw a handful of students were utilizing our nursing tutor, Sister Pat. I think that's great. If you're struggling, remember she can help you zone in, focus on the need to know information when you're feeling overwhelmed with tons of content that's being thrown at you. And she can also do practice questions and help you with test taking strategies. Reminder to follow the chain of command if you have any issues. So start with your instructor. If it's lab or clinical, start with the lab or clinical instructor. If you can't resolve it at that level, you then talk to the lecture instructor. If it doesn't get resolved at that level, you then talk to Dr. Terry. All right, let's look at our practice questions. These were prioritization practice questions. So when you were reading the question, you were looking for any keywords such as priority, most important, those strategic words that let you know, hey, this is a priority question and I need to use my priority test taking skills. So what are those priority test taking skills? They are looking at the answer options and prioritizing things that are physical over safety, over feelings. And then of the physical answer options, you'd use the ABCs. Airway and breathing or respiratory issues or interventions would be prioritized over other interventions. So the ABCs, airway, breathing, cardiovascular. So let's look at these questions. You have someone who's delusional, thinking they're getting poisoned. What's their priority? The student did CAPS priority, which lets us know, okay, I'm going to use my priority test taking strategies. Look at my answer options. See, are they physical, safety, or feelings? And then from the physical, if that was a correct answer, you'd look at the ABCs. This student put C, safety and security, which is correct for this answer option. So it's just a reminder to these NCLEX style questions, they aren't always black or white. Like, you just told us it's physical first. I picked physiological needs. With this patient, there's nothing that's saying they have any physical needs, but they definitely have some safety concerns with what's going on. So C is the correct answer for that one. 2, you got someone with a cervical spinal cord injury. What is the nurse going to do first? This student put in CAPS first, which lets us know this is a priority question. She picked C, muscle flaccidity. Again, you're learning these test-taking strategies, so don't get hard on yourself if you get any wrong. C is actually an incorrect answer. It's not unusual that I see students wanting to put something about muscles because it's a spinal cord injury and they might not be moving like they should. But using our test-taking strategies, she recognized first as a priority or as a strategic word for a prioritization question. So the next step would be to then ask, are my answer options physical, safety, or feelings? These are all physical answer options. So from there, the student should say, okay, do we have ABCs? Listening to breath sounds is related to the ABs, right? It's a respiratory answer option, and that makes that one the correct answer. Priority intervention for your client during severe asthma attack. She identified priority as strategic word, and she picked C, which is correct, to give quick relief rescue meds. Sometimes we have students struggle between oxygen and the rescue medication, and in those, they're both related to respiratory status, so it can be difficult. In those instances, when you get it down to two answer options, and you can't pick out which one's the best answer option, sometimes it helps to ask yourself, if I can only do one thing and then I'm going to leave the patient's room, what would be most beneficial for the patient? And that could help guide you towards the priority answer option. So in this one, the med that's going to fix the problem is prioritized over oxygen. If I was going to do one thing for them and then leave for the rest of the shift, the giving them the med that fixes the problem would be a higher priority. If I just put oxygen on them, the asthma attack could keep getting worse, right? If that was the only thing I did. So that can help with those types of questions, helping you pick out the right answer. You got a brainstem injury. What's the priority? Priority is your strategic word. She picked C, peripheral vascular status. She said she's worried about lack of blood flow, which is a concern, but it's not the correct answer. So using our test taking strategies, right? Hopefully you see now that D, because of respiratory rate and rhythm, is the correct answer because it's related to the respiratory system. So again, these prioritization questions, don't feel bad if you're struggling with them now. It's a new test taking strategy that you're just learning. So we're practicing them. You're going to keep practicing them on your own, even using EAQs. You're going to see questions like this come up and you're going to get more comfortable using the test taking strategy instead of letting your mind sort of take you down the wrong path and picking answer options for prioritization questions. Don't doubt the test taking strategy. Follow it to improve your test scores. All right, so question 5, worried about a PE, what are you going to do first? Oxygen, IV, ECG, or ABGs? I would say first is probably the prioritization word, the strategic word in this question. The student picked A, which is correct. Apply oxygen. You got someone getting lidocaine for dysrhythmia. What are you going to watch most closely? She did pick most closely, which is great. She picked radial pulse and peripheral pulse. There's a better answer option here. The correct answer is D, respiratory status and blood pressure. Respiratory status makes it the correct answer. 7, got a client with smoke inhalation. What are they experiencing? Pain, fear, anxiety, or hypoxia. Again, you haven't learned smoke inhalation yet. So if you get these wrong, don't beat yourself up. We're just learning. The student picked B, which is actually incorrect. So the correct answer is hypoxia. Just another reminder, if you have an answer option related to the respiratory system, you want to really consider it, see if it makes sense for the question. Another tip here is fear and anxiety are both feelings that are kind of similar. And if you have two similar answer options, usually neither one is correct. Or on the other hand, if you have two answer options that are opposites, high blood pressure, low blood pressure, high sodium, low sodium, usually one of those is correct. They're not great test questions, so you don't see them all the time. But if you do see them, those are some tips that you could use. All right, 8 here, got a heart attack, getting nitro, it didn't work. They got morphine now going. What's your priority action? So priority, she identified correct. She picked monitor respirations and the BP, and that is correct. Respiratory is going to be prioritized. So good job there. 9, prolonged ambulating after prolonged bed rest. The nurse determines the client needs to stop immediately after finding what? So she says immediately to let us know it's a prioritization question. She picked B, shortness of breath and diaphoresis, which is the correct answer. Shortness of breath is related to respiratory status. We got another respiratory answer option, but those are normal findings, right? So for that reason, we picked B. 10, question you're seeing in this course, and you'll see it in the future, likely, if I keep doing what I'm currently doing. Just had students have an exam with this test question on it, and over half of them got it incorrect, even though they had already seen it before in this course and learned their test taking strategies. So let's look at it. You're going to handoff report. Who are you going to see first? It says first, prioritization question. This student picked D. Got someone getting radiation today. I frequently see A because the heart rate's a little elevated. My heart rate could be 108 if I was grading you during a skills checkoff any day of the week. So it's elevated, but nothing too crazy is going on. I have students who pick neutropenic and protective isolation because they know we're worried about a cancer patient getting infections. But the correct answer option is B, older clients on chemo with mental status changes. One of your handouts that you have is about prioritization and what makes a stable patient, or words you might see for a stable patient versus an unstable patient. And one thing that is can be a clue for an unstable patient is if they're undergoing changes. So anytime an assessment finding is changing, that makes that patient a high priority patient. Math was 2 ml. She got that right. For the hand washing, you're going to wet your hands, apply soap lather, scrub for 20 seconds, rinse under clean water, and dry with clean towel. These order type questions are new question types possibly for you that you might see on the NCLEX. Next one, you witness someone collapse. What are you going to do? Check for responsiveness, check breathing, palpate the carotid artery for pulse, begin chest compressions and airway. So we teach ABC, 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 but remember your basic life support for a witness collapse would be CAB. Okay, those are your questions. If you have any questions about those practice questions and you want to discuss them, just reach out and we can go talk about them or look at your answer options specifically and talk about what you picked, why it was correct or why it was incorrect. This week, go over your week 10 expectations. I flipped from what it was originally scheduled for this week and next week. So this week, you're listening to your welcome. You're going to read chapter 9. You're going to listen to a recording about delegation and a math review. You have a discussion board activity, a guide for calculating I's and O's that you just need to view. If you find it helpful, go ahead and print it out. And then practice questions related to delegation, which is a recording you're going to watch. Next week, then, majority of your time will be spent working on a project that you're going to do. So you'll be able to locate information about the project on Canvas. You can review the rubric and the project description and let me know if you have any questions. And finally, don't forget you'll have a final reflection paper related to the class. That rubric is posted on Canvas as well for you to see. It's not due until finals week. I'll open up the Dropbox a couple weeks early and let you know about that. But if you wanted to start thinking about it, you're able to locate the rubric on Canvas now. So have a great week 10. I'll be back on week 11 with the majority of your time that week working on your group project.